I'm Rebecca Marmore. I'm a Johns Hopkins vascular surgeon. I practice out of Howard County General Hospital. So dialysis is a process by which we purify our patient's blood. It's required for patients whose kidneys no longer work, those who have what we call end-stage renal disease. So a lot of patients ask me, why do I need dialysis access? Why do I need this surgery? And what I ask them to think about is if they've ever had an IV that's infiltrated in their arm. Their arm gets big and poofy and it's very painful. And that happens because their vein is too small to accommodate the IV and whatever fluid is infusing through it. Similarly, if we try to connect our patients to a dialysis circuit with their natural small veins, it won't work. Their arm will get big and swollen and we won't be able to circulate their blood. So instead, we have to create an artificial connection between their artery and vein, or place a plastic vein underneath their skin to allow them to hook up to the circuit. So typically, patients are referred to my clinic by their nephrologists or their kidney doctors, who are closely monitoring their blood work and see their kidney function is slowly declining over time. Sometimes patients go to the hospital and it's discovered that their kidneys are just not functioning. And then I'll even see them in the hospital to talk about dialysis access. So one of my favorite parts of being a vascular surgeon is developing a longitudinal relationship with my patients. So I get to meet my patients, some of them, before they've even started dialysis. And we talk about all of the different options for dialysis access. But our relationship doesn't end after the surgery. I follow my patients, especially my dialysis patients, for years. And over time, most of them will need additional work to keep their dialysis access going. And that's my privilege as their vascular surgeon. We meet, we catch up, we see how their lives are going, and we also check in on their fistula or graft. And it's not uncommon for my patients who have kidney disease to also have other problems with their blood vessels. And when that time comes, we're happy to evaluate and treat them as needed.